You're 6 weeks pregnant. Congratulations! This is a major milestone. Even though your bump isn't showing yet, big things are happening inside your body. Let's take you through what's going on with your baby, your body, and what to expect next. First, let's talk about your baby. At week 6, your baby is still tiny, about the size of a lentil, or around 6 millimeters long. But don't let the size fool you. This is a critical week for organ development. The heart has started beating. Yes, that tiny flicker is now a pulse. It's beating at around 110 to 160 beats per minute, faster than an adult heart. Your baby is starting to form facial features. The eyes, ears, and mouth are beginning to take shape, though they still look more like tiny bumps than anything recognizable. The neural tube, which will become the brain and spinal cord, is also closing around now, and small buds are forming, which will become your baby's arms and legs. Inside you, a little miracle is unfolding. Now let's talk about what's happening to your body. By now, hormones are in full swing, and you might be starting to feel it. You may experience nausea, tender breasts, fatigue, and even emotional ups and downs, all completely normal. Your body is also producing more blood to support the growing baby. That's why some women feel lightheaded or dizzy. It's also why your heart rate may increase slightly. Your uterus is expanding, and though you won't see a bump yet, you may notice bloating. Some women even feel mild cramping, which can be scary, but it's often just your uterus stretching. Let's talk about what symptoms are normal and what's not. Some women feel a lot at this stage. Others, barely anything. Both can be completely normal. Every pregnancy is unique. However, if you experience severe pain, heavy bleeding, or anything that just doesn't feel right, always contact your doctor. It's better to check than to worry. A lot of women also experience something called morning sickness. But here's a myth buster. It doesn't just happen in the morning. Nausea can hit any time of day, and for some, it doesn't happen at all. You might also notice a stronger sense of smell, food aversions, or cravings. Hormones are to blame here too. Now here's something you might not expect: your emotions. Hormonal changes can make you feel more sensitive, anxious, or overwhelmed. This is common and doesn't mean anything is wrong. Be kind to yourself. So, what should you be doing right now? Take your prenatal vitamins daily, especially folic acid. Eat balanced meals, even if your appetite is off. Small, frequent meals can help with nausea. Stay hydrated and rest as much as you can. If you haven't already, book your first prenatal visit. Most doctors schedule it between weeks 8 and 10, but it's good to plan ahead. And if you're wondering if your pregnancy is progressing normally, here's the truth. Unless you're told otherwise, it probably is. Pregnancy doesn't come with a rule book, and there's no right way to feel at this point. Your experience is yours. So take a deep breath. You've made it to 6 weeks. That's something to celebrate. And we'll be here every step of the way. Make sure to subscribe to Dear Mama so you don't miss next week's update. Week 7 of pregnancy, the changes you'll start to feel.